Diabetes, a widespread metabolic disorder, affects millions worldwide. This chronic condition, characterized by high blood sugar levels, has become a global epidemic, impacting people of all ages and backgrounds. The prevalence of diabetes continues to rise, making it a significant public health concern that requires ongoing attention and management. While manageable with proper care, it can lead to serious complications if blood sugar levels remain uncontrolled. These complications can affect various organs and systems in the body, leading to a range of health issues that can significantly impact quality of life. From cardiovascular diseases to nerve damage, the consequences of poorly managed diabetes are far-reaching and can be life-threatening. Two such complications, diabetic ketoacidosis or DKA, and hyperosmolar hyperglycemic nonketotic syndrome, also known as HHNS, demand immediate medical attention. DKA is more common in individuals with type 1 diabetes, while HHNS is often seen in those with type 2 diabetes. Both conditions are severe and can develop rapidly, requiring prompt recognition and treatment to prevent serious outcomes. Understanding these conditions, their differences and the importance of timely intervention is crucial for anyone affected by diabetes. Early detection and appropriate management can make a significant difference in the prognosis of these emergencies. Education and awareness are key components in preventing these complications and ensuring that individuals with diabetes can lead healthier lives. This exploration aims to provide clarity on DKA and HHNs, empowering individuals to recognize warning signs and seek appropriate care. By being informed about the symptoms and risk factors, patients and caregivers can take proactive steps to manage diabetes effectively and reduce the likelihood of these emergencies occurring. Both DKA and HHNs arise from severely elevated blood sugar levels, often exceeding 600 milligrams per deciliter. Such extreme hyperglycemia can overwhelm the body's ability to regulate glucose, leading to a series of metabolic disturbances. These disturbances can cause dehydration, electrolyte imbalances, and acid-base abnormalities, which can be fatal if not addressed promptly. This extreme hyperglycemia disrupts the body's delicate balance, leading to a cascade of potentially life-threatening events. In DKA, the body starts breaking down fat for energy, producing ketones that accumulate in the blood and cause acidosis. In HHNs, the high blood sugar levels lead to severe dehydration and increased blood osmolarity, which can result in coma or death if untreated. Recognizing the early symptoms of these conditions is essential for prompt medical intervention and improved outcomes. Symptoms of DKA include excessive thirst, frequent urination, nausea, vomiting, abdominal pain, and fruity scented breath. HHNS symptoms may include extreme thirst, dry mouth, fever, confusion, and hallucinations. Awareness of these signs can lead to quicker diagnosis and treatment, potentially saving lives. By understanding the nuances of DKA and HHNs, we can strive for better diabetes management and reduce the risk of these serious complications. Effective diabetes management involves regular monitoring of blood sugar levels, adherence to prescribed medications, a balanced diet, and regular physical activity. Education on the importance of these practices can empower individuals to take control of their health and prevent emergencies. These conditions, while sharing some similarities, present distinct characteristics that necessitate different treatment approaches. DKA treatment typically involves insulin therapy, fluid replacement, and electrolyte management. HHNS treatment focuses on rehydration, insulin administration, and addressing any underlying causes. Understanding these differences is crucial for healthcare providers to deliver appropriate care and improve patient outcomes. This exploration delves into the intricacies of DKA and HHNS, highlighting their differences and providing a comprehensive understanding of these diabetic emergencies. By examining the pathophysiology, symptoms, and treatment strategies of each condition, we can gain a deeper insight into how to manage and prevent these life-threatening complications. With knowledge as our guide, we can navigate the complexities of diabetes and strive for a healthier future. Empowering individuals with the information they need to manage their condition effectively can lead to better health outcomes and an improved quality of life. Through education, awareness, and proactive management, we can work towards reducing the burden of diabetes and its complications on individuals and society as a whole. Diabetic ketoacidosis, or DKA, is a serious complication that primarily affects individuals with type 1 diabetes. It is a life-threatening condition that requires immediate medical attention to prevent severe health consequences. DKA develops when the body cannot utilize glucose or sugar as fuel due to an absolute or relative insulin deficiency. This deficiency can be caused by various factors, including missed insulin doses, illness, or infection, which can increase the body's demand for insulin. Insulin, a hormone produced by the pancreas, allows glucose to enter cells for energy production. Without insulin, glucose remains in the bloodstream, leading to elevated blood sugar levels. Without sufficient insulin, glucose builds up in the bloodstream, leading to hyperglycemia. Hyperglycemia is a condition characterized by high blood sugar levels, which can cause various symptoms such as frequent urination, excessive thirst, and fatigue. In the absence of glucose as fuel, the body turns to fat stores for energy. This alternative energy production method is not as efficient and leads to the production of ketones. This process produces ketones, acidic byproducts that accumulate in the blood, leading to a dangerous condition called ketoacidosis. Ketones can cause the blood to become acidic, which can disrupt normal bodily functions and lead to severe complications. DKA typically develops rapidly, often within hours or a few days, and requires immediate medical attention. The rapid onset of DKA means that individuals with type 1 diabetes must be vigilant in recognizing the early warning signs. Understanding the causes, symptoms, and treatment of DKA is crucial for individuals with type 1 diabetes. Common symptoms of DKA include nausea, vomiting, abdominal pain, shortness of breath, and confusion. If left untreated, DKA can lead to severe dehydration, coma, and even death. Early recognition of DKA symptoms and prompt medical intervention can significantly improve outcomes. Treatment typically involves administering insulin to reduce blood sugar levels, fluids to rehydrate the body, and electrolytes to restore balance. Individuals with type 1 diabetes should be vigilant in monitoring their blood sugar levels and seeking medical help if they experience any DKA warning signs. Regular blood sugar monitoring and adherence to prescribed insulin regimens are essential in preventing DKA. Remember, DKA is a serious but treatable complication, and timely action can make a world of difference. By understanding the risk factors, recognizing the symptoms, and seeking prompt medical care, individuals with type 1 diabetes can effectively manage their condition and prevent the occurrence of DKA. Education and awareness are key components in the fight against this life-threatening complication. While insufficient insulin is the primary trigger for DKA, several factors can contribute to its development. Diabetic ketoacidosis, or DKA, is a serious complication that arises when the body cannot produce enough insulin. This lack of insulin leads to elevated blood sugar levels and the production of ketones, which can be life-threatening if not managed promptly. For individuals with type 1 diabetes, missing insulin injections or experiencing insulin pump malfunction can lead to a dangerous drop in insulin levels. This drop can cause the body to start breaking down fat for energy, leading to the accumulation of ketones in the bloodstream. These ketones are acidic and can cause the blood to become too acidic, a condition known as acidosis. Without insulin, glucose cannot enter cells, setting the stage for DKA. The cells are starved of energy, and the body starts to break down fat as an alternative energy source. This process releases ketones into the bloodstream, which can be detected in the urine and blood. High levels of ketones can poison the body, leading to symptoms such as nausea, vomiting, abdominal pain, and confusion. Illnesses, such as infections or the flu, can also increase the body's demand for insulin. When the body is fighting an infection, it releases stress hormones like cortisol and adrenaline. These hormones make it harder for insulin to work properly, causing blood sugar levels to rise. This increased demand for insulin can precipitate DKA if not managed correctly. During illness, the body releases stress hormones that counter the effects of insulin, further exacerbating the situation. These stress hormones can cause the liver to release more glucose into the bloodstream, making it even more difficult to control blood sugar levels. This can create a vicious cycle where high blood sugar levels lead to more stress hormone release, further increasing blood sugar levels. Additionally, certain medications like corticosteroids can increase blood sugar levels and contribute to DKA development. Corticosteroids are often prescribed to reduce inflammation, but they can also cause the liver to release more glucose and make the body less sensitive to insulin. This can lead to higher blood sugar levels and increase the risk of DKA. It's crucial to note that while DKA is more common in type 1 diabetes, individuals with type 2 diabetes can also develop this condition under certain circumstances. Although type 2 diabetes is typically characterized by insulin resistance rather than a complete lack of insulin, severe stress or illness can overwhelm the body's ability to produce enough insulin, leading to DKA. Factors like severe illness, pancreatic damage, or certain medications can disrupt insulin production or effectiveness, potentially leading to DKA in individuals with type 2 diabetes. For example, severe infections or conditions like pancreatitis can impair the pancreas's ability to produce insulin, increasing the risk of DKA. Therefore, understanding the potential triggers for DKA is essential for all individuals with diabetes. By recognizing the signs and symptoms early, individuals can take steps to manage their condition and prevent the development of DKA. Regular monitoring of blood sugar levels, adhering to prescribed insulin regimens, and being aware of how illnesses and medications can affect blood sugar are crucial steps in preventing this serious complication.